To throw more light on the implications of non-deployment of medical interns, we speak to Professor Frank Asimwe, who is a professor of urology and kidney transplant at Mulago Hospital. Prof, many thanks for joining us this evening. Briefly explain how the lack of deployment of medical interns has affected service delivery in our hospitals.
Thank you very much. It's a pleasure to be on the set. The effect is immense. In the hospitals which train interns, a lot of work will remain unattended to. In the hospitals which don't train interns, they may not feel anything. But the bigger burden is on the medical profession per se. For as long as you're not bringing new doctors into the system, you're going to pay the price much later in the future. As has just been explained, some doctors who paid a lot of money to be trained are sitting at home not working. It's like going in a forest and you're cutting down the young trees. It is very bad for our profession. And I think really the problem is because of lack of planning. We are failing to handle a bumper harvest. The Ugandan population is growing. There has been liberalization of education, and so people are being trained, and Ministry of Health sits and is surprised that the numbers are coming out the way they are coming out. We are expecting to have a doctor-patient ratio of 1 to 500. That is according to the WHO. But now we are standing at 1 to 20,000. So when do we expect to close that gap if the people who are being trained are either being looked at as a burden or they're being kept out of the system? I think that's our main problem. The other big problem is looking at the interns as students. Interns are not students. They've completed a 5-year course. They have been awarded bachelor's degrees. They are no longer even graduates, they are graduates. Internship is only an apprenticeship. It's not having a student. These people are having an apprenticeship. And so the issue of looking at intern doctors as students is part of the problem. But I think when I did my internship in 1996, we were employed by the public service and were looked at as doctors. I think when the economies changed and they were overwhelmed by numbers, now they flipped. It's like saying, I cannot afford meat or chicken, and therefore you tell your children, now for us, we cannot eat chicken. It is our totem. So the Ministry of Health needs to wake up
Allow me come in here, Prof. You talked about government paying the price. So in the event that the medical interns are actually not deployed, what is likely going to happen? But also we understand that there is no money to facilitate their deployment. If they had planned for about 1,000 of them and you have over 2,000 graduates, if it were you, what would you do?
I will not answer the question about money. That again goes to the planners for this country. They must find the money. One of the things they need to do is to increase the internship centers. Right now, we should be able to have interns in district hospitals. We have 120 districts. If you narrow it down to the district hospitals which can take up interns, maybe they're about 80. We should come to the private hospitals in the city and in the cities that are mushrooming in the whole country. These hospitals should be staffed with medical officer special grades. Uganda right now is producing up to 150 specialists per year. These specialists should be, first of all, promoted to the rank of associate consultants or medical officer special grade, and then deployed in the district hospitals, but also the ones who are going to the private for-profit hospitals should be recognized as such. And if a hospital, for instance, is doing 10 cesarean sections in a week, they should put a benchmark, and these private hospitals should be brought on board so that interns can have more centers to go to. That is one of the solutions. But hiding our heads under the sand that there is no money is not a solution.
Prof, maybe I should ask that what would be another alternative of saving the situation? Because one, you have over 2,000 medical interns who are seated at home doing nothing. You also have patients in hospitals that are dying and a non-responsive government. What would be the other alternative?
Find the money, deploy the interns, period. There is no other alternative.
Frank Asimwe.